Okay, so tell me a little bit about yourself and how you got involved in the disability realm.
Yeah, absolutely. So it was a little bit, I always describe it as being kind of tortuous, finding my way towards the rehabilitation realm of healthcare. But so I'd say probably let's start with college. So prior to about 2016, I really couldn't decide how to channel my academic and personal skills and interests. And in college, I studied chemistry and knew within a few months after graduation that working in a lab or going into academia at all was not going to be a good fit for me. So I worked in biochemical research for about 3 years before I made the jump to try to go to veterinary school because I always had this childhood dream of being a veterinarian. And so I dabbled in the veterinary world for about 3 years. I worked in general medicine, emergency medicine, and also veterinary ophthalmology, which was a really cool job, really, really cool job. But it wasn't the best. It didn't feel right. It didn't feel like the good kind of fit. And so I found myself, let's say probably circa 2016, as I mentioned before, not really knowing what I was going to do with my life. And around that time, as I was struggling to find my calling, a friend, a really good close friend of mine, sent me a video of a cat with bionic legs. And I was immediately hooked, of course, having this interest in veterinary medicine and healthcare and all of that. And I just became immediately intrigued with the field of prosthetics and orthotics. So I took that as an opportunity to change my path a little bit. And I worked in human ophthalmology for about 2 years. And working in that field, I discovered my passion for pediatrics. And so while I was doing ophthalmology technician work, I took some classes that I needed for prosthetics and orthotics school. And long story short, I got into the University of Washington's program. And I have been training and studying as a clinician pretty much ever since. And it's 100% the best niche for me. I've found my calling. It's really wonderful. And as I mentioned, I love kids and working with kids. So I'm really trying to steer towards that specialty and hopefully eventually get those animals back into my life because I really miss working with animal patients. So hopefully we can dabble in the veterinary realm of orthotics and prosthetics moving forward. But kind of in a nutshell, it's like the perfect nexus between art, medicine, and science for me. And what I love about being in rehabilitation is helping those in need achieve, maintain, regain their mobility independence, and really being given that trust by patients is the hugest honor that I have as a clinician. So a lot has happened in the last like 10 to 12 years to get me here, but I finally made it.
Yeah, that's cool. So my next question is tell me about your work as a certified orthotist. What's the day-to-day like?
Yeah, it's one of those, it depends. And I feel like that's an answer we have all the time in this field is it depends. But so I am a certified prosthetist as well, kind of more recent, but I would describe myself as an orthotist at heart. That's really more my thing. And so, and I'm kind of reading a little bit, so if I'm kind of straying, it's just so I make sure I hit all my points. So as an orthotist, I work with an array of individuals with varying presentation, functional needs, etiologies, diagnoses, prognoses, which really makes for a very interesting and at times very challenging job. I would say my favorite aspect is personalizing each individual's devices to fit their very specific needs. And then hopefully from that, witnessing their upward rehabilitative trend and trajectory. And the relationships that I get to build with patients is really rewarding, whether it's brief, if someone needs an off the shelf knee brace, one and done kind of thing, or if it's diabetic shoes and foot orthotics. There's a little bit of a follow up, but not so much. But if someone needs an ankle foot orthosis or a knee ankle foot orthosis or a back brace, it just really depends on what they're getting, what they need it for, how long I'll get to be working with them. But I'd say the day to day varies. It can. I mean, like today I have a lot of meetings and have to do a lot of charting and things like that. But on a day where I see patients, I will evaluate them. And so that can include measuring, casting, doing range of motion testing, muscle testing. and definitely taking history so that I can provide myself a context as to who the patient is, where am I entering in their timeline? And so I know that I can build a story and make the best decisions to fit within their specific needs and what their life is. So, kind of going into that, I make clinical decisions about their care. I will come up with an idea of what device to give them, especially if it's custom, I'll design it. And so I will dictate to our fabrication technicians what I want the device to look like and what components I want it to have and things like that. If we're doing in-house custom work, I will do plaster work. So when I take a mold of someone's extremity, we'll say I take a mold of someone's leg, and I'm going to make them an ankle foot orthosis. I fill it with plaster so that I can make a positive model. And then I make modifications to that plaster model so that I know that when plastic is pulled over it under vacuum, that I'm accommodating for bony anatomy, or I need to offload a specific area if they have ulcers or callousing. Anything, it's all very individualized, which is really fun. And as I mentioned, yeah, and of course, there's those days where I do chart notes and review referral notes, and I communicate with physicians and physical therapists and parents, and it is it's very eclectic type of week. No week is the same, no day is the same, which I think is really fun. I right now typically see patients in the Seattle office, but I will travel to hospitals and schools to see those patients in need, and especially those who have a difficulty accessing the clinic for their care. And my last little sentence I have here is the most common device I provide is an ankle foot orthosis, but those come in so many flavors. To put it simply, there's no single, we call it an AFO. There's no single AFO that's appropriate for everybody. And with that, I pretty much work with any joint in the body. We don't do a lot of cranial stuff here in our office, but that is something that an orthotist does as well.
Mm-hmm. Yeah. My next question is, you worked on a paper with Dr. Christy Bjornson. What's that all about?
Yeah. So that was a really, really fun podcast that I got to do with her. I felt really honored to be asked to speak, especially not having been an author on the paper. So I didn't actually participate in the research. The previous orthotist that she was working with has retired. He retired earlier this year. So I stepped in, and his name is Garth Shippen. And I describe myself as the new Garth to all the parents that knew him really well. Really big shoes to fill, but it's been really fun. And so I started working with Dr. Bjornson this past March, and it's really been the highlight of my professional experience to date. It's just been really invigorating and challenging and really eye-opening. So she's a pediatric physical therapist who practices a particular approach to orthotic intervention for those children that are neurologically impaired, usually under the umbrella of cerebral palsy or other conditions that present like cerebral palsy. And the particular method that she practices is called the Oscar orthotic method, and it's developed by this woman, Elaine Owen, who's really renowned in the UK for this, and we're starting to adopt it a little bit here in the US. But it's Oscar stands for the Optimal Segment Kinematic Alignment Approach to Rehabilitation. It's a bit of a mouthful, so we abbreviate it to Oscar. And it's something when I was in school, gosh, I think we had a day dedicated to it. So it was not something we delved deeply into at all. So when I started working with Dr. Bjornson, I was like, I know I learned that somewhere at some time, and it's somewhere in my head, but it's really different from how we normally approach orthotics, to put it simply. And so this particular school of thought really focuses on optimizing over time static and dynamic hip, knee, ankle alignments of children through the use of custom lower limb orthotics, usually AFOs. And this is like a couple of types we'll use. There's a little algorithm and formula that we use. But we also really focus on the shoe wear that they're using, because the profile of the shoe and how it impacts with the ground changes how the device actually operates against the body. And so we do it that way because we want to preserve the bony architecture as they grow and make sure we're not we want to make sure we're getting everything aligned so their body can continue to grow and get stronger over time, and they can be more functionally independent is the main goal. So her work, Dr. Berenson's work, is very well regarded. I've been completely honored to get to collaborate with her and grow as a clinician for these pediatric patients. And it's just really cool to see firsthand the positive transformation that a lot of these children make over the course of their treatment. And so that's really what the paper is about. It's just about a particular trial study that she did with Garth and some of the other authors, just talking about what variables they had, what they, they're just their particular approach, like how we plantar flex the foot, how we accommodate for that contracture, how we incline the shank so that they can get better roll through stance so that they're having optimal gait biomechanics. And so the paper just really, it's just evidence that it actually works. So it's really cool to have been able to be a part of that. And she and I are talking about doing another study, which will be really fun. So stay tuned for that.
Yeah, that's cool. My next question is, what stuff do you do when, uh, ah, what stuff do you look for when working with a patient with a different neurological or physical condition? Like, how do you create that sense of independence and autonomy for those individuals?
That's a great question. So when I was thinking about this question and formulating an answer, I tried to come up with four main aspects that to respond to this in terms of treating patients. So I factor in their cognitive status, I factor in their functional status, their physical status, and then of course their goals. And by investigating and understanding all four, I'm in a better position to actually provide care that is optimized and individualized for that particular individual. Any orthotist, in my opinion, that takes a kind of a cookie cutter approach to care is really providing a disservice to their patients. And unfortunately, I think you can see that in some practices where a clinician will see a diagnosis and then just kind of come up with a standard device to give them, but not really think outside of the box and thinking of how to optimize that to make it really perfect for that individual. In my opinion, and it's no surprise, the human body and the human condition are very nuanced. And so there's really no single intervention that's going to fit every single person's needs, even if the diagnosis and the prognosis is the same. It's my job to locate their positions on the spectra of like their realities, their goals, their needs, and provide them with devices that are going to maximize their quality of life. So thus, in summary, for my evaluations, I really attempt to paint a comprehensive picture of each patient and target what's going to satisfy and uplift them the most. I attempt to create independence and autonomy by simply listening to them and engaging in a really two-way conversation. And I really think it's important for each patient to have a say in what their intervention is going to be. And it helps me manage their expectations. It helps them manage their expectations of me. And it gives them a place to choose and have, let them be vulnerable, let them question what I'm doing, let them worry about what I'm doing. And so that I can help them. I want them to feel comfortable opening up to me so that I can implement any criticism or any feedback into making everything better for them.
Mm-hmm. I guess my last question that I have is, what can people take away from this? What two pieces of advice would you give someone with, who's with a physical or neurological disability, or let's say for the sake of argument, like in your position as an orthotist?
So I would say, so working in this field has really opened my eyes to the vast array of individuals in need and of orthotic and prosthetic care. It's kind of a niche you don't think about. And then once you start working in it, you realize how many people out there need it. So Some people need minimal intervention. Like I mentioned, someone needs an off-the-shelf knee brace, probably something they could get from Amazon, but they're going to get it through us, and that's fine. Or really specific and intense needs, whether it's just one leg is involved, both legs and both arms. And I would say two pieces of advice is it for any individual seeking need of orthotic care. Don't be afraid to question your clinician's choices and advocate for yourself or your child or whoever you're taking care of and speaking for. Every person deserves the best medical care, and I think that orthotics is no exception by any means. So find a provider who listens, communicates honestly and openly with you, and makes demonstrative strides to go really above and beyond for your care. I would say the only thing is also maybe be a little patient. Sometimes there's a little wait time with obtaining devices, but my opinion is that if it's done methodically and correctly, it's worth the wait. So just stick with your principles and your morals and share those with the orthotist that's caring for you, and make sure that they're taking that to heart.
Yep, those are great pieces of advice for sure.